Thank you, Devin. And according to the American Lung Association, COPD affects 12.5 million adults and costs billions in healthcare.
Goodness, and here to tell us more about this is Nurse Christina Paris of the VA. Thanks for joining us this morning.
Hi, good morning. I'm glad to be here. Actually, November is COPD Awareness Month.
How appropriate.
It's a very timely topic.
Right? Yeah.
So what exactly is COPD and how does it affect the lungs?
So to understand COPD, you have to kind of understand how the lungs work. So when we breathe in, air goes down into our lungs and into these bronchioles, these little air sacs, and they're super, super thin, like one cell. And so it allows the oxygen to go from our lungs into our bloodstream, which takes it to all of the cells in our body, which need air. So when you have COPD, it's a airway, it's inflammation. And then the inflammation that can occur in the lungs causes the lungs to fill with like this fluid and mucus, and it gets thick, and over time that mucus causes our lungs to just be kind of flabby, and they're not really productive in this cell transformation, and so that can cause real problems.
Yeah, absolutely. So now, if someone believes that they're at high risk, what are the symptoms that they should be watching out for?
Sure, so chronic cough. People talk about the smoker's cough, shortness of breath while doing everyday activities, maybe even just sitting or getting up and getting dressed can wear you out. Coughing up sputum, or phlegm or mucus. Anytime that you might be feeling like hearing wheezing, which is kind of a high-pitched whistling sound. Decreased, you're gonna feel fatigued, and that's due to the decreased oxygen in your lungs. You might have reoccurring lung infections like bronchitis, pneumonia, and you're constantly, you get over one and boom, you're sick again. Yep. Difficulty taking in a deep breath. So some people with COPD will have difficulty with that. Poor appetite, because believe it or not, when you're struggling to breathe, think about when you have your worst cold and your nose is really stuffed up and you can't breathe at all through your nose and you're trying to eat. Like you can't breathe and eat and swallow at the same time. It's really, really challenging. And so people with COPD who have difficulty breathing, it can really wear you out and cause you not to want to eat because of the difficulty. And they might have like blue lips, blue fingertips, things like that. When you're not getting enough oxygen, you're going to see that. And then a barrel chest. So people with COPD, because sometimes the air will get in there, it gets trapped, it can't come out. And so your lung just slowly over time gets bigger and bigger. So you might see that too.
And then is there a cure, or at the very least, some type of treatment for COPD?
So there is no cure. So prevention is huge. We want to make sure that we're preventing it. And then there are treatment options. So, but some of the things you want to do, absolutely, if you smoke, you want to quit smoking. COPD, there are medications you can take. There's pulmonary rehabilitation where they'll help you kind of work on strengthening your lungs. Like really it's cardio, you kind of get working. You can have oxygen, maybe a non-invasive ventilation, which is kind of like, it sort of looks like a CPAP thing, but it's not, but kind of works similar. There's endobronchial valve therapy where they can put a valve in it's a one-way valve that goes down in your lungs, allows the air to come out. There's clinical trials, surgery, inhalers, things like that.
So there's a lot of things.
There are a lot of things that you can do.
So this isn't the end of the world then?
No, but absolutely prevention is the best.
Absolutely.
Yeah, when I was looking up statistics though, it was pretty cool to see that actually Wisconsin is on the lower side of statistics as far as how many people have COPD.
That's good.
Yeah, Pennsylvania was one of the top. Of course, California, Texas, and Florida, but that's with, pollution and environmental and people. But Pennsylvania, but then I thought about the steel and coal mines, things like that. There's a lot of mining. And then in Michigan was high too. And I thought about manufacturing. There's a lot of car,
Just
Detroit,
wild how that can...
A lot of environmental world factors can trigger this.
It's not just smoking, although smoking is bad, but yeah, there's a lot of other things that can trigger it.
Very interesting how that can change just in a very short geographical distance. Because Michigan's our neighbor.
I know.
So it's crazy.
But go Wisconsin, we're doing good.
There we go.
Yay for Wisconsin.
We're breathing well, and if you aren't, there's always ways that you can get treatment.
Absolutely. Go and talk to your doctor if you're getting any of those symptoms.
Well, thank you so much for coming in and educating us about this.
Glad to be here.
Thank you.
And coming up, we have